How are things going?
Yeah, not too bad.
How did you go on the weekend at footy?
Dr. Simon Jackson admits he's spreading himself too thin.
Are you carrying any injuries from Saturday?
Oh, pulled off.
You know, rural GPs and GPs in general are being asked to do more and more. So just keep that arm nice and still. So I haven't had a day off in the past 3 weeks, and that's just the nature of what's happening with the job at the moment.
His practice is in rural South Australia, where the wait to see a GP can be as long as 6 weeks. Dr. Jackson says he's struggling to find doctors willing to help ease this unsustainable workload.
It's not what we want to be doing, and it's not the safest option long term.
And we've been saying for at least 20 years now that we were predicting there were going to be GP shortages because it takes about 12 years to train a GP.
Across the country, the number of GPs is falling. It's estimated this shortfall could be as high as 10,000 by the end of the decade, with regional and rural Australia worst affected. That's prompted calls for the federal government to boost training places and make general practice more financially attractive by overhauling bulk billing rates.
The Medicare rebate, we have estimated, only covers 50% of our costs, and if they're going to continue to promote bulk billing, then they need to appropriately remunerate doctors to provide that.
On the other side of the country, in North Queensland, the shortage of GPs has led to a more drastic proposal, allowing pharmacists to prescribe drugs that normally require a doctor's script.
To be able to have patients to have timely access to available healthcare is the most important thing.
But the backlash from doctors has been ferocious.
This is not the solution. Patients deserve doctors. They don't deserve a dangerous experiment that puts their health at risk.
There's been no public outline of the details, only a leaked draft document from earlier this year that listed 23 new conditions that pharmacists could prescribe drugs for, such as asthma, gout or nausea. Pharmacists would need to undertake a minimum of 120 hours of supervised training.
If you think about flying on a plane, would you trust a bus driver with a bus driver's licence to fly your plane after 120 hours of online tutorials?
The Australian Medical Association walked out of the consultation process.
Well, I guess it's pretty obvious with a conflict of interest. If you're the one prescribing something that you're going to sell later, that's your conflict there. There needs to be a separation between prescribing and selling.
Can you see there's a potential conflict of interest once you break down that separation?
There is a potential for that, but there is a national requirement to provide the best possible outcomes for the patient. That exists whether it's pharmacy or whether it's medicine.
On the ground in the proposed North Queensland trial site, pharmacist Kate Whalen is expecting the public to embrace the change.
We do have really difficult conversations with some of our patients who come in saying, look, can you give me something to help me, you know? I'm nauseous or I'm vomiting and, you know, I've tried to make an appointment and I can't get in to see my GP.
We won't do anything that hurts.
But Cairns GP Aileen Traves remains deeply sceptical.
Unfortunately, this proposal from the Queensland Government is to basically have pharmacists acting as doctors without the training to actually be doctors. So this is a fast-tracked political solution to workforce shortages.
Observing from South Australia, Dr. Jackson is not convinced. He believes pharmacists can be part of the solution, but not alone. They need to work closely with GPs.
Every medication has its risks. Every medication has its potential side effects, and I think that really needs to be evaluated appropriately before it's prescribed to a patient.
On top of the safety concerns, doctors in Queensland claim the Pharmacy Guild has undue influence over the Palaszczuk government.
And I pride myself in integrity and transparency in government.
The Queensland Premier recently curbed the activities of Labor-linked lobbying firms. One of these firms, Anacta, has been acting for the Pharmacy Guild.
And we don't know what effect that's had, but that's something for the government to answer.
The Labor-linked lobbying firm Enacta has been lobbying on your behalf, hasn't it?
We do employ Enacta, yes, but it is something that we want to see to the table. When you have such an entrenched barrier that is the Queensland Health Department employs a lot of medical professionals, and included in that is doctors.
So Enacta has helped you get over that barrier?
I wouldn't say that. Enacta has certainly worked with us to be able to provide a great policy platform.
The Pharmacy Guild says doctors are simply engaging in a thinly disguised turf war.
I think the AMA have coming from a point where they're trying to protect business, and they will use the patient safety aspect when realistically said the risk is minimal.
The timing for the trial has been pushed back. The Queensland Health Minister, Yvette Darth, was unavailable for interview, but she told 7:30 the government remains committed to the pilot.
The most important thing is that it happens, and I don't think that the Australian population is going to continue down this path with the lack of GP access standing idly by.
It's not as simple as just give them a medication. That's not what we do in medicine.